Welcome to the SNF Spotlight Series, brought to you by Renewal Rehab, a dynamic therapy company that provides full-service therapy for nursing homes. You'll be hearing from some of the leading nursing home professionals in the country, as well as many healthcare heroes that are sacrificing day in and day out to help your loved ones recover and come home to you.
Welcome to another fantastic episode of the SNF Spotlight Series. I'm your host, Yitz Rubin, Director of Business Development for Renewal Rehab, and I have the privilege to be talking to a long-term client of ours, the founder and chief executive officer of Pearl Healthcare, Eitan Zeffren. Eitan, can you tell us a little bit about you and Pearl Healthcare?
Yeah, absolutely. Thank you for having me. It's a pleasure to be here. So about myself, I've been in this industry since I started really joining the workforce, but really long before that. Grew up in a family that was surrounded with healthcare, so it was an exposure that I had even as a young child. Going to facilities and doing activities, with my mother and other family members, and it's been something that was pretty ingrained in me since a young age. I had the opportunity to work for some great organizations, and Symphony Post-Acute Network was where I was able to get the vast majority of my training in this industry. After my experience and my time there, I was really excited about the idea of being able to do something, on my own, where I felt we would be able to, put my spin on what I would like our facilities to look like and the type of care that we like to provide, and to use, a lot of that, the previous experiences to be able to, influence that positivity into the organization that I create. When the first facility that we looked at became available, it was an instantaneous fit. We knew that it was the right place for me to start this journey, and that's been about 2 years. We had our second anniversary on November 1st, so that was really our place where we got started, and it's been a tremendous experience, and it's been a challenging experience, but most importantly, it's been very rewarding.
So you've been in this industry for a while with family and running many different operation roles with Symphony. What did you see that you wanted, specifically, what did you envision of adding to the industry and saying, hey, I want Pearl Healthcare to look like this? I
think everyone has their own strengths, and one thing that I felt was something that I gravitated towards was, just the interaction and the personal touch when it came to my employees and our residents and their families as an extension of that. So, my true, vision was not to necessarily reinvent the wheel in many aspects, but really to be able to do something as an organization where I would be able to have that availability and that time to put that personal attention, from this level into my facilities, and to be able to interact and get to, have those personal relationships with the staff. And being a regional and a small regional operator, that's exactly what it allows me to do. So I'm happy that we're at a size and that we are, realistically able to put in that time, and I'm able to be in the buildings on a daily basis and have that interaction. So really, the individualized care that's needed for people, because we're dealing with people. We're not dealing with inanimates, and in order to do that and really to provide the highest level of care, that individualized attention is needed, and it starts really at the top. So for me to be able to do that, I hope would show the staff that that's the same that we provide for our residents as well. And I think that, so far we've been, really grateful and happy to see that come to fruition.
Over the past decade or so, the industry has been changing rapidly, and especially over the last 2 years with PDPM coming in instead of rugs, and now with the crisis. Would you say that this was like an advantage for a younger company because you were able to be a little bit more flexible as opposed to, a company that was going for a long time?
Absolutely. I think that there is that benefit. I think, there's both advantages and challenges that you need to overcome as a small organization. The advantages, like you said, are being able to steer the ship quicker and being more nimble in your ability to be able to roll out new processes, new policies, and to really have that education at a more intense level. Those are things that you can roll out quicker and more efficiently. So absolutely being smaller and having that agility is an advantage. The disadvantage obviously is you have to really be resourceful in making sure that you're gathering as much information as possible and educating yourself as much as possible. With not having as many resources as some of the larger organizations may have, or access to certain things. You have to be really proactive and making sure that you are staying up with the times as far as reimbursement changes, regulatory changes, and obviously most recently with COVID, all the information is constantly coming out, and making sure that we are keeping ourselves up to date with that is of the utmost importance. So we've really devoted our personnel to be committed to educating themselves so we can best educate those who are caring for the residents in our buildings.
So there have been a lot of precautions that the regulatory government bodies have been taken to help the patients and keep them safe. Do you feel that there has been like open communication and understanding from the healthcare operators and owners, like that information accessible?
Yeah, I think that it's accessible. It's deciphering it that's sometimes where the majority of the work is. And you're dealing with multiple regulatory bodies who are giving guidance to be able to assist the facilities and assist the operators in as much as possible. I think for the most part, there's definitely challenges that early on that I think a lot of operators saw with getting a lot of information and sometimes a little bit confusing information. But as you work through it and other operators being that resource as well, working together to make sure that we are communicating efficiently with those regulatory bodies and that we're implementing the best strategies based on the information we're getting. So overall, it has been very effective.
So you're leading a team of a staff that really cares for the patients and really trying to take care of them, especially during this time. The patients may not have as much outside contact as in the past. What would you say, like the staffing, like how are they feeling? How's the staff, their spirits like keep changing with regards to the rules, and like how are they handling this?
Initially there was that, I think that shock, if you will, of when we had to shut our buildings down to outside visitation and limit to essential staff. So that dynamic, definitely impacts the building. But as we adjust and as we've gone through this, the staff and the residents, which I'm sure we'll talk about, but the staff have really done a phenomenal job of adjusting and recognizing the fact that the way that our industry looks today is different than it looked like, a few months ago and in the beginning, in the onset of the pandemic. the industry looked different this week than it did the week prior. So as we were implementing everything that was coming out, whether it be the necessary PPE that has to be worn, the mandatory testing, all of those elements that change the routine of your staff and change the mindset that they are used to, they have really grasped the understanding and the importance of it. And I think we're tremendously grateful for the fact that they recognize the seriousness of it, both for their safety, the residents' safety, and yeah, so it's definitely been an adjustment, but they have adjusted, so it's been positive.
So during this pandemic, you guys are really dealing with some of the most acute patients, the elderly that are it's so dangerous, this disease. It sounds like a real challenge. Like, how do you feel like being the industry in general hasn't been portrayed very well, the nursing home? Like, how does that feel coming from that side, from the other side?
I would say that through this time, we have been really surprised and in a positive way to see the rush of support and the concern from the community and the families. They have sent meals to the staff. They have sent thank you cards. They've done a tremendous amount to recognize them, which was unprecedented. We hadn't seen it to that level prior. So when you do have those moments for your staff to be able to get the recognition that they really truly deserve, it's an awesome thing to see. And it's really on us as operators and owners to supplement that recognition that they so very much deserve. So ensuring that we're giving the employee appreciation and giving that engagement that they need and that they deserve is really our responsibility. So when it comes to the staff and taking care of patients that have multiple comorbidities, are in a clinical situation that has them compromised, it can be a scary situation, and the residents and staff build close relationships. So there's a deep level of care there and connection that people tend to forget about sometimes, and how that impacts your staff.
So Pearl Healthcare recently partnered with Concerto, and now you guys offer InHouse Dialysis as well. What else do you, with like overall census being impacted in skilled nursing facilities, not as many patients, how do you encourage the minimal patients and the hospital caseworkers to see the value of coming into your home over some of the others in the area?
Yeah, that's a challenge that exists regardless of the time and what's going on. There's always good competition, and there's always other facilities that offer great services. In-house dialysis for us has been a huge added service that we've been able to provide to the community and to the hospitals and to those residents that come here, especially during this time where going in and out of the facility is something that we try and limit as much as possible. Our ability to be able to treat and dialyze those patients in-house from a safety standpoint has been a big selling point to people, knowing that they don't have to go out into the community 3 times a week to have those services and limit their exposure. That's definitely something that I think is a big advantage that we have amongst our competition. Ultimately, it boils down to trust, and if that trust that we've spent a great deal of time building, if we maintain that and deliver on that with the care that we're providing patients, and they see it, then ultimately it speaks for itself.
You recently have a newly renovated, updated, state-of-the-art gym, as well as newly renovated private and semi-private suites. Can you tell us a little bit more about the rehab program, and are people doing more room therapy in the room? Like, how is that working?
As this whole, pandemic started, I think that we thought a lot about that, and we had, conversations with our therapy partners to brainstorm what we can do to ensure that we're able to provide the same level of therapy without being able to utilize the gym perhaps as much as we'd like. So we were lucky to partner with a company called Restore that in conjunction with Renewal Rehab, and that allows us actually to deploy mobily a TV that allows the patients to interact with a software that's really incredible to watch, actually, and allow them to increase their gait training, their balance, something that normally would maybe be constrained to a gym, but being able to roll that into a patient room and utilize that program is just an example of how we have to kind of adjust to the times that we're in. So we're really excited to see those results, and grateful to have a partner that's been willing to work with us and come up with the best strategies to be able to do that.
Eitan Zeffren, founder and CEO of Pearl Healthcare, thank you so much for joining us on the SNF Spotlight Series, and thank you guys for watching another episode.
Thank you. Have a great day.
Thank you for listening to the SNF Spotlight Series. Please subscribe to our channel, as there will be many new and exciting episodes from our healthcare heroes.